My name is Grace Davis. Today is Saturday, August 28th, and I will be filming a head-to-toe assessment as a student nurse practitioner. I've just verified my patient identity and performed hand hygiene. I'd like to start my exam by saying that throughout the exam I'm going to be assessing the skin of the head, face, neck, posterior and anterior chest, abdomen, and upper and lower extremities for the color, temperature, texture, moisture, turgor, any tenderness, bruises, lesions, scars, and nevi. And I'm also going to be assessing the upper and lower extremities for color, temperature, skin integrity, and edema. I'm going to go ahead and start by looking at the head, its size, symmetry, and midline positioning. I'm going to assess the hair for its color, texture, and distribution. I'm going to palpate the scalp for any infestations, depressions, tenderness, masses, or lesions. Anything tender on your scalp?
No.
Great. I'm going to palpate the temporal arteries for any tenderness. Any tenderness?
No.
Okay, I'm going to go ahead and I'm going to assess the lymph nodes up your head and neck. I'm going to start with your preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and your supraclavicular. Any tenderness?
No.
Okay, I'm going to assess cranial nerve 5, which is the trigeminal nerve. I'm going to start by assessing the motor sensation by palpating your masseter muscle as you clench your jaw. Great. I'm also going to assess your TMJ for any subluxation, crepitus, or tenderness as you open and close your jaw. Any tenderness?
No.
Great. I'm going to assess the sensory sensation of cranial nerve 5 by doing light touch to your face. If you'll close your eyes and tell me where you feel this touch.
Forehead, nose, cheek, chin, cheek.
Great. I'm going to also assess cranial nerve 7, which is the facial nerve, by assessing for symmetry as you smile, frown, pucker your lips, puff your cheeks, and lift your eyebrows. Now I'm going to assess your eyes. I'm looking at your lashes, your eyebrows, and your palpable fissures. I'm going to assess your sclera and your conjunctiva for any discoloration, lesions, or discharge, which there are none. I'm going to assess your cranial nerve 3, which is your ocular motor nerve. I'm going to assess it for its direct and consensual response to your pupil's direct and consensual response to light. If you'll look at my nose, I'm going to shine this light in your eyes. And again. And do this again. Okay. And I'm now going to assess for the internal structures of your eye and the red reflex. Looks good. Looks good. I'm now going to assess, continue to assess cranial nerve 3 as I assess for accommodation and convergence. So if you'll follow my finger inwards. Great. And now look at the window and look back at my finger. Okay, I'm going to assess your conjugate gaze, which also assesses cranial nerve 3, 4, which is the trochlear nerve, and 6, which is the abducens nerve. So if you'll follow my finger with your eyes. Great. I'm going to assess cranial nerve 2, which is the optic nerve, by assessing your gross acuity and your peripheral and central vision. So if you'll occlude one eye and read the smallest line that you can.
EDFCZP.
Great, and now do the other side.
EDFCZP.
Now do both eyes.
FELOPZD.
Great, that is 20 out of 30 vision and 20 out of 25 vision. I'm now going to assess your ears. I'm going to palpate the trachea, the tragus and the pinnae for any tenderness or masses. Any tenderness?
No.
Great. I'm now going to assess your tympanic membrane and auditory canal. I'm going to be looking for pearly gray tympanic membrane and the cone of light. Looks good. And now on the other side, I'm lifting up because you're an adult. Looks good. I'm now going to assess your cranial nerve 8, which is your vestibulocochlear nerve, by assessing for your hearing. So we'll first do a whisper test. So if you'll occlude one ear, I'm going to whisper 3 things and you just say them back to me.
1, 2, 3.
Okay, now do your other ear and do the same thing.
1, 2, 3.
Great. While I'm back here, I'm going to assess your peripheral vision. So if you'll occlude one eye and tell me when you can see my finger.
I can see it.
Now the other side.
I can see it.
Okay, now both fingers.
I can see them.
Great. I'm now going to assess the Weber's test for lateralization. If you'll tell me if you can hear this the same out of both sides or just one.
Both.
Great. Now tell me when you can no longer hear this. I'm assessing Ryan's test for air conduction greater than bone conduction.
Okay.
Can you still hear it?
Yes.
Great, I'm going to do the other side.
Okay.
Can you still hear it?
Yes.
Great. I am now going to assess your mouth, so if you'll open your mouth for me and say ah, and lift up your tongue. Great. As I was assessing your mouth, I was looking at your lips, teeth, gums, buccal mucosa, your tongue, your palate, your posterior pharynx, your salivary ducts, and your tonsils. If they were present, I would grade them. And I was also assessing cranial nerve 9 and 10, which is your glossopharyngeal and your vagus nerve, for the soft palate and uvula to rise symmetrically with phonation. And I also assessed cranial nerve 12, which is your hypoglossal nerve, when your tongue was midline without any fasciculations. I'm now going to assess your nose. I'm looking at its shape and its symmetry and its size. I'd like to assess nasal patency by having you occlude one nostril and sniff. Now the other side. I'm going to assess cranial nerve 1, your olfactory nerve, by having you close your eyes and tell me if you can what you smell.
Dill pickles.
Okay. And I'm going to also assess your frontal and maxillary sinuses for any tenderness. Any tenderness?
No.
Great. I'm now going to assess your neck. I'm assessing for its symmetry, its midline positioning, and its shape. I'm assessing your trachea for its midline position, assessing your thyroid gland. So if you'll swallow for me. Great. And now the other side. Swallow again. Okay. I'm now going to assess for your carotid arteries. If you'll turn your head this way. Now back this way. Okay. And I'm going to assess the carotid arteries for any bruise with the bell of my diaphragm. Which I hear none. And I'm going to assess cranial nerve 11, which is the accessory nerve, by having you shrug up your shoulders. Grants my resistance, which is good. I'm now going to move on to assess your chest. I'm looking at the posterior and anterior chest for any obvious deformities and for its symmetry. I'm assessing for any obvious signs of respiratory distress, which includes use of accessory muscles, retractions, nostril flaring, pursed lip breathing, tripod positioning, tachypnea. If you'll turn and face your back towards the camera. I'm going to assess for symmetrical lung expansion. If you'll take a deep breath in. Great. I'm going to assess for tactile fremitus. If you'll say 99.
99, 99, 99, 99.
Great. I'm going to percuss all your lung fields. Listening for any dullness, timpani, or resonance. Now I'm going to auscultate your lung sounds. You'll take a deep breath every time I move my stethoscope. Gotta make sure I get the lateral fields. Great. I'm now going to test for egophony. If you'll say the letter E every time I move my stethoscope.
E, 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 E.
Okay. I'm now going to assess for whisper pectriloquy. If you'll whisper the numbers 1, 2, 3 every time I move my stethoscope.
1, 2, 3.
Okay. I'm now going to assess for bronchophony. If you'll say the number 99 every time I move my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. All those tests were negative, and you can now face the front of the camera. I'm going to again assess for symmetrical chest expansion. If you'll take a deep breath for me. Great. And I'm going to assess for tactile fremitus. If you'll say 99.
99, 99, 99, 99, 99, 99.
Okay. I'm now going to assess your anterior lung fields. Take a deep breath every time I move my stethoscope. All breath sounds are clear with no adventitious lung sounds, such as crackles or such as crackles. And now I'm going to listen to your heart sounds. So I'm going to start with auscultating with my diaphragm. Your aortic, which is the second intercostal space right sternal border. Pulmonic, which is the second intercostal space left sternal border. Erb's point, the third intercostal space left sternal border. Tricuspid, the fourth intercostal space left sternal border. And the mitral, which is fifth intercostal space midclavicular line. This is also where I would listen for the apical pulse and assess it for a full minute, paying attention to the rate and rhythm. This is also where I'm going to feel the point of maximal impulse, and I'm going to palpate it. I'm going to go back again and listen to all the heart sounds with my bell, the aortic, pulmonic, Erb's, tricuspid, and mitral. Okay. I'm now going to have you stand up and go lie down on the couch for me if you can. Okay, with the head of the bed at a 35-degree angle, I would assess for jugular vein distension. I'm going to, again, listen to your heart sounds with my diaphragm and with my bell as you're laying down. Your aortic, pulmonic, Erb's, tricuspid, and mitral. And I'm going to do the same with my bell, aortic, pulmonic, Erb's, tricuspid, and mitral. I'm assessing for any heaves and lifts as you're laying here, and I would also palpate for thrills over each of my auscultation points, aortic, pulmonic, Erb's, tricuspid, and mitral. I'm now going to move on to assess the abdomen. I'm assessing for contours and symmetry of the abdomen. I'm going to begin by auscultating the abdomen for any, with my bell for any breweries over the aorta, the renal arteries, the iliac arteries, and the femoral arteries. I'm going to then listen for any lung sound or bowel sounds. I hear normal active bowel sounds, and I heard when I listened to your heart sounds clear S1 and S2 with no murmurs, rubs, or gallops. I'm now going to percuss the abdomen for any tympany or dullness. I'm going to go into a light palpation of the abdomen for any masses or tenderness. Are you tender?
No.
I'm going to go into a little bit of a deeper palpation for masses or tenderness. Any tenderness?
No.
Great. I'm now going to palpate your liver and your spleen, which I'm unable to feel. Okay. I'm going to have you sit up now, and we can go back to the chair. As you're walking, I'm going to be assessing your gait. And then if you'll pause right there for me, I'll move the camera. And if you'll walk back to the chair with heel to toe, and I'll assess your tandem gait. Great. And then while you're standing, if you'll close your eyes and place your arms out in front of you, I'll assess Romberg's. Great. And then if you'll hop in one place on your foot, assess your balance. Great. You can now sit down. If you'll face your back to the camera, I'm going to assess for any CVA tenderness. Any tenderness?
No.
Okay, you can turn back and face the camera. We're now going to assess your upper and lower extremities. Whenever I'm going to be assessing the joints of your shoulders, elbows, wrists, fingers, hips, knees, ankles, and toes. And I'm going to be assessing for any redness, tenderness, swelling, deformities, symmetry, crepitus, and nodules. I'm going to begin by palpating your shoulder joints, your elbows, your wrist, and your fingers. While I'm here, I'm going to assess capillary refill, which is less than 3 seconds, and I'm going to assess your radial pulses, which are 2+ strength. I'm going to go ahead and assess your hip joints, your knee joints, ankle joints, and your toe joints. I'm going to assess capillary refill, which is less than 3 seconds. You can relax your feet. I'm going to assess your dorsal pedis pulses and your posterior tibial pulses, which are great. I'm now going to assess the strength of your feet. So if you'll push your feet down against my hands, and lift back up. Great. Now push out against me. Now pull me back in, assessing the strength of your knees, and I'm going to assess the strength of your hips. If you'll push my hands out, pull them back in. Okay. Now I'm going to assess the strength of your hands. If you'll squeeze my fingers. Great. I'm going to assess your tricep and bicep strength. If you'll pull up. Now push back down. Now I'm going to assess your shoulder girdle strength. If you'll pull me out. Okay. Now push me back in. Great. All strength is 5 out of 5. I'm going to go ahead and assess your sensory vibration to your proximal ulnar prominence. Can you feel this?
Yes.
Can you feel this?
Yes.
I'm also going to assess it to your medial malleolus. Can you feel this?
Yes.
Okay. Can you feel this?
Yes.
Great. If you'll close your eyes for me, I'm going to assess light touch sensation of the upper and lower extremities. So just tell me where you feel this.
Arm, shoulder, hand, shoulder, knee, leg, toe, ankle, hip.
Great. Now I'm going to assess range of motion. So we'll start in your fingers. If you'll flex, extend, hyperextend, and then abduct away, abduct in, and do thumb up position. And we'll do your wrist, flex, extend, hyperextend, ulnar deviation, radial deviation, and rotation. We'll now assess your elbows. If you'll flex, extend, hyperextend. And we'll now assess your shoulders. If you'll flex, extend, hyperextend. We'll do internal rotation up, external rotation to your back. And then we'll do abduct, put your arms away, adduct, bring your arms in, and then we'll do circumduction. Great. I'm going to assess your cerebral coordination now, so we can do serial finger opposition. Great. Now we'll do hand flip-flop. If you'll go like this and pick up the pace. Okay. Now we're going to do finger to finger, so if you'll follow your finger to mine. Okay. And we'll do the other side. Great. And now I'm going to assess for stereognosis and graphthesia, so if you'll close your eyes for me. I'm going to place, for stereognosis, I'm going to place an object in your hand, and you can tell me what it is.
Penny, pencil, pen.
Okay. And now if you'll keep your eyes closed, I'm going to draw an object to assess for graphthesia, and you'll tell me what it is.
An X,
Okay.
a pound sign.
Okay. And now you can open your eyes, and I'm going to assess for your reflexes. I'm going to, if you'll relax your arm for me, I'm going to assess your brachioradialis, your bicep, your tricep, and then on this side, brachioradialis, your bicep, your tricep. I'm going to assess your patella reflex, if you'll relax your leg for me. I'm going to assess your Achilles, if you'll relax again. And I'm going to assess Babinski. Okay. I'm now going to assess your range of motion of your lower extremities. So we'll start with your toes. If you can flex, extend, hyperextend, abduct your toes, abduct your toes. Okay? And we'll do your ankles now. Flex, extend, hyperextend. Sorry, flex, extend, hyperextend. We'll do external rotation, internal rotation, and circumduction. Great. And then I'm going to have you stand up for me, and we're going to have you test the range of motion of your knees. So you'll do flexion, extension, hyperextension, and then again flexion, extension, hyperextension. And then we'll assess your hips. So if you'll do flexion, extension, hyperextension backwards, and I'll get on the other side, flexion, extension, hyperextension. Great. And then we'll do abduct away, abduct across, and then internal rotation, external rotation, and then again on the other side, abduct away, adduct across, internal rotation, and external rotation. And then we'll do circumduction, circumduction here. Great, and now I'm going to assess your spine. So we'll do a flexion of your lumbar and cervical spine if you'll flex forward. And I'm going to assess for any signs of scoliosis. I'm assessing for any obvious deformities or curvatures, which it looks good. Any tenderness here?
No.
Great. You can stand back up. And so now we'll do, that was flexion, extension, hyperextension all the way back. And then we'll do lateral flexion on the other side, and then rotation, cervical, and then rotation of the lumbar and cervical. And then you can sit down for me. And I think that concludes our assessment. Thank you.
Thank you.